most famous physical therapist on the internet.
Hi folks, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
And together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Kind of went like this, Brad. I don't know where you look.
Well, there's something behind Lonnie. I couldn't quite tell.
All right, well, and by the way, we also see some other new people out there, Brad.
Yes,
in case you're new to our channel.
Three of them today, Bob.
Please take a second to subscribe to us. Our subscription button is over here or down here, depending if you're on your phone. We provide videos on how to stay healthy, fit, pain-free, and we upload every day.
Excellent.
Let's get into our topic of the day, Brad. It's the psoas muscle. Is your psoas muscle tight? Is it weak? How do you tell this? How do you fix it? Why do you want to fix it? All these questions.
What is the psoas?
Right.
The psoas is one of those, it's like Psoas because it's spelled wrong. It's spelled with a P.
P-S-O, yeah.
It's like pus psychology. Anyway, so
you sound like a putty cat.
Yeah. So the psoas muscle, let's look at it.
Yeah, let's take a look at it. So I'm just going to go this far, Lonnie. This should be all right, right? The blue one. Okay. So it's actually a very big, strong muscle, Brad.
Oh, yeah.
And I've only showing one side, all right? This actually is on both sides, and it attaches down into the lesser trochanter of the femur. But it attaches to these side bones here and onto the side of the vertebrae and the discs themselves.
So it's attaching to the low spine, the low back.
Right, the low back. So and then it attaches down here. So can you see if this is a tight muscle? Can you see how it's going to squeeze all these bones together, Brad?
Yeah, maybe we can look at it from a profile.
Sure.
So if this muscle contracts or gets tight, it pulls this direction, which takes the back and arches it forward because it has no other place to go.
It's going to arch it like this. It's going to make it arch. That's where
get that arm out of the way, Bob.
Some people
arch,
call
Bob, arch. There
they call the anterior pelvic tilt.
Right in here.
Because it's that muscle is tight, and you know it's not hard for that muscle to get tight, Brad, because it gets tight while you're sitting.
Right.
So if you sit a lot,
right,
and you don't stretch.
Sure. Now, one thing that we should clear up, Bob, is what is the job of this muscle? This job's muscle is a hip flexor.
Right. It pulls, so you can see if this is attached here and holds on, it's going to actually lift up the hip here.
Now, so if you're marching in place, those muscles are responsible for a majority of that.
But can you see if we fix it here, Brad, you know what it's going to do here? It's going to side bend you.
Okay.
It's going to bend you off to the side, and that's going to be important later. I'll show you why.
Okay.
But right now, just mainly think of it as a hip flexor. There is another muscle right here that attaches into here. It's called the iliacus, and they come together actually, Brad.
Sure.
And that's what a lot of times they call it the iliopsoas both together.
Right, kind of a combination muscle.
There are other couple muscles that help with hip flexion, and we'll have to talk about them too.
You bet.
But right now, that's probably good enough for a start. So again, picture this on both sides. Big, strong muscle. If it's tight, it's going to compress all the discs together and could give you some back issues.
Sure.
So you do want to stretch it if it's tight. So let's talk about that first. How do you tell if it's tight? Well, one thing, Brad, is a simple way is when you're standing, and if you tend to stand with that anterior pelvic tilt, and you can't flatten your back while you're standing.
Let's move this arm forward. So we're looking at this part of the low back. Yeah, pull that.
It might look good to look at my belt line, Brad.
There you go.
If you can't flatten your back, see how my belt line is moving forward here, now it's moving back. If you can't flatten your back while you're standing, you might have a tight psoas muscle.
Right.
But we'll show you a better way to test
I mean, there could be some other things causing that too, but that's one of the
tests.
Right.
Okay, the better way to test it is to actually go off the edge of the bed here.
Sure, yep. Let's try and isolate it.
Yep. So you're going to have your knees kind of, maybe 6 inches or so off the edge of the bed here. Yep. And then I'm going to lay back, and I'm going to pull this leg up. Now, my leg actually does come up a little bit, but believe it or not, it's not my psoas that's tight. It's my rectus femoris or my tensor fasciae lata.
Sure.
And I know we're probably confusing people here, but let's say you do this and the leg really comes up.
Right. So
okay.
Right. So if this happens and you're relaxed and there's a gap like this here, there's a good chance that this muscle's responsible.
It might be tight, but you have to do one more thing, Brad.
Okay.
You have to have someone straighten the leg for you, and then see if the leg will go down.
Yeah. Then if it drops down really easy,
then it's definitely. If it doesn't drop down, it is that muscle.
Right.
Okay.
Right.
If it stays up. Even when you straighten the leg, then it is the iliopsoas or the psoas muscle.
Sure. Yep. Yep.
Okay. Is that clear as mud?
Yeah.
So again, pull up, goes up, straighten it, still stays up, it's tight.
Kurt, you got it.
Okay. All right, so if it's tight, how are you going to stretch it? There's a lot of different ways we can stretch it. Probably the most simple way is one way we can do it is just the way we were doing it, Brad.
Yeah.
Just put it off the edge like this, and actually it's best if you keep it a little bit straight, because otherwise you're stretching the tensor fasciae lata.
So when he says off the edge, and he's coming this direction towards the camera.
Don't fall off the bed.
Right, because you need to have room for the hamstring area right here to drop down.
Yep.
And then, and if I was doing this to a patient and I wanted to get a more aggressive, this is what I would do gently. This is, gravity is usually more than enough.
Right, exactly. So you can stretch both sides that way. You flip around and do the other side.
Right, otherwise you walk in circles.
Yeah.
Oh,
Brad loves that joke. He's told that joke. Okay, pillow.
Oh, yeah. We got to get on with the stretch. Sorry about that, Bob.
This might be the better way even to stretch, Brad. This is the way I do it. So you're going to go ahead and lean forward like this. Good posture.
Yep.
Remember that we don't want to go in like this.
Right, that's critical. That's your upright.
Okay, but there's a little twist here, Brad.
Okay.
You remember this muscle is a side bender. So in order to add a little more stretch to it, you can actually bend to the side away from it.
Right.
And that's going to really isolate on that psoas muscle.
One thing I tell my patients, I say, imagine there's a rope right around your belt line and it's going to pull your hip forward that way, and that's really going to help. And then, like you said, a little side bend to the opposite direction, and yeah, you'll feel it.
And I do.
Both legs on that one too, right?
Yep, both legs on that one. Or what will happen, Brad?
I'm not going to go there. All right.
So another way would be, Brad, to actually, this is really quite a stretch, isn't it?
Yeah, yeah. It looks like you are having fun, Bob, but it is, So you got to have a bed may work, but you need a firm table.
Right,
typically.
a firm mattress like that. This really stretches it, Brad.
Oh, yeah.
And the leg's straight, so I mean, it is focused on the psoas muscle.
Right. So, and again, you're up as high as you can get right there as far as your shoulders arching back.
Yep.
Right.
Oh, yeah, I can go up a little bit higher.
The further you go, the more aggressive the stretch will
Let me go right into the next one, Brad, which actually is you can do press-ups like this. This is going to stretch your back, but this is also going to stretch the iliopsoas, or the psoas and the psoas muscle.
Exactly. So the idea is keep the belt line glued to the table.
Right.
Show them the wrong way to do that, Bob. Yeah, that's not going to do anything.
If you can only go up this high, only go up this high.
Right.
If you can only go up a little ways, work your way up into it,
right,
and eventually get to it. I think one more way, Brad, would be to, I got to watch out for my mic here.
Yeah, be careful with that, Bob.
You can't sit down, Brad.
Oh, sorry.
Would be to lay on your side, and you could stretch it like this. Now, again, this is going to get the rectus femoris too, and everything.
So he's talking about a muscle that goes from your hip down to your knee, and you'll definitely feel that.
Yeah, but you're going to get the psoas too.
Yep.
I mean, you're going to get both.
It's a double header.
Yep, that's one way to work on both. All right, Brad. How do we tell if it's weak? Pretty simple, isn't it?
Well, we test it.
Yep, we just test it. So you sit in a chair.
Yep.
You're going to have somebody that helps you. You lift it up, and they're going to push down on that leg.
Hold it strong. Hold it. Hold it.
Okay, that one was fairly strong. How about this one?
Okay. Now,
I may have faked that.
Now, any healthy person, it's an adult, go ahead and lift it up. And normally it's, you can put a lot of weights through there, and it's going to hold like a rock. And it's good. You got two legs, test one.
You can test one or the other, and you can see. And if they're both weak, if it just drops right down, you may need some strengthening. And one way to start with strengthening, Brad, is to just do it in the chair. What you can do, put some weights on. You got some weights over there?
You want some weights, Bob, don't you?
Yep.
We lost them.
Oh, there they are, right there.
You want some ankle weights?
Yeah.
Sure.
You get some ankle weights at any of the big box
So
stores.
you're simply going to do some marching, is that correct?
Yep, exactly.
Yeah.
So very simply,
We'll just do one leg.
Yeah, you're going to work on, slowly bringing it up and doing some repetitions that way.
And I think it is important, now you probably were going to get into this, that you also do it in a standing position.
That's exactly where I was going next, Brad, is to start doing it, working in the standing position, because you're getting a good range then, aren't you?
And, I always put my hand up in front of me. I say, get your knee up to my hand as best that you can. And, the higher you can get it, the more range of motion.
And you can probably alternate, have them on the other.
A lot of times people that are doing this may be weak if, they're after a surgery or older or whatever, then a walker or something to hold on to cover is good to have. Yeah.
Brad, you want to show it on the ball?
Oh yeah, this is one of my favorites. This is for a higher level person. Can you get down to the floor, Lonnie? Or okay, if you're, you know, pretty strong, fairly agile and athletic, this is a really good way to work it. And you're going to have to move, Bob.
Yep,
I
sorry.
don't want to bump my head into your... Okay, so you get out about to here. Is that okay, Lonnie? And you simply keep your back strong. Right here. Can you point to that, Bob?
Sure.
Right there.
Right here. Keep this
Yep,
thing
don't let it
strong.
arch. Keep it nice and neutral position and simply bring the knees to the chest. And that works those hip flexors. And if this gets too easy, you can do 10 or 15 of these. Simply go to one leg. And that helps quite a bit to make it more.
Well, I'm glad I had you do this one, Brad. I don't know if I could do one leg.
This is the one I always like to do this, Bob, just for fun. But you don't have to do this for hip flexor, but it's a good balanced one.
It actually is working the hip flexor a little bit when you do
Little
that.
bit it is.
All right, the other thing you can do, Brad, come on over here, Lonnie, now. You can buy these furniture sliders.
This is one of those simple little things.
Yeah,
that
these are very inexpensive. You
Right.
can get like 10, 15 bucks at the most. And there's a whole bunch of exercises you can do with them, but you can actually put your feet on them. And you can do what they call mountain climbers.
Yeah.
So you're getting some hamstring with this too, and hip extension, but you're working the hip flexors too.
Oh yeah,
believe me.
this is a great overall workout. You just keep going, Bob. Those furniture gliders are things you put on the bottom. If you're not familiar with them, you put
furniture
them on the
sliders.
sliders.
Yeah, but gotta call them slider because otherwise you'll get you the wrong thing.
Yeah.
And you'll watch it on Amazon.
And they work good for sliding furniture as well as exercise.
That's exactly right. That's what my wife used it for. So, thanks everybody for watching.
All right.